My dear friends and colleagues from Poland, thank you for the opportunity to be with you, at least in spirit, and congratulate you on 25 years of just marvelous accomplishments with Stomos. I first came slightly before on a visit commissioned by Project Hope in 1989 or 90 to assess the possibility of a school of public health, because the people at the Polish American Children's Hospital were very interested in perhaps setting up a school of public health. If you recall 1990, Poland was a pretty grim place. In fact, I would stay at the Europski Hotel, and there were elements of good health behavior because they would have or ask that they had a non-smoking section in the restaurant. And in fact they did, and I sat there every night that I was staying at the Europski, and nobody joined me. But I came back several times over that period of time, and interestingly, more and more people were joining me. And unlike other countries in Europe that I knew about, the people sitting in the no smoking area were not smoking. And so I think there was a real commitment of movement, which I think is a real tribute to the leadership that you and your colleagues have been able to accomplish through Stoma and dealing with the policymakers and the managers as members of your organization. As we all know, healthcare is throughout the world having unprecedented change, which will be in fact having significant implications for the role of management. Let me just name a couple. The whole notion of genomic medicine and its implications for clinical medicine is really changing how healthcare will be provided. The technology, the arrangement, the hierarchy that is usually associated with normal medicine is now being realigned in terms of genomic medicine, raising all sorts of ethical issues, program issues, process issues, etc. Another major change which I think is occurring is the digitalization of healthcare and medicine, advances in computational sciences, the development of electronic medical records, again, having a real empowerment on the part of the population once this technology is in fact being installed. Also, I think around the world there is a concern about evidence-based medicine and value-based healthcare. The issue historically underutilization of services. Increasingly, we're being very concerned about the overutilization of healthcare services, and what are the implications of this, which clearly affect the price and the cost of delivering health services, really constrained by the available resources that a country is able to provide. Another factor, another influencing force, I think, is the whole notion of commercialization of health services. New players are coming into the healthcare market. This is really changing the playing field, and new organizations and the existing organizations now need to know how to accommodate the commercialization and what it means in terms of providing health care. All this is occurring within a complex, dynamic, political, economic, and social environment. And how we manage this is probably the critical issues, whether we're going to be successful or whether we're going to fail and not capitalize on all the challenges and opportunities which are being provided. Edward Deming, as you well know, is the father of sort of quality management, quality improvement. I think he really captured the challenges that we face within healthcare when he said, "The problems are with the system, and the system belongs to management." It's not only the problems, it's also the opportunities belong to management. So an organization like Stomos I think has a very critical role to play, because it provides a forum for debate, not only among the management personnel at all levels within the organization, but also the relationship to the policymakers. And to the extent to which there's a partnership there, to the extent to which there's communications, and I know it's very, very difficult because resources are always limited, but this dialogue will help move us forward and realize the potential, managing the challenges and taking advantage of the opportunities. It's within that spirit that I wish you well as you move forward, and hopefully for the next 25 years be able to accomplish many, many things that you so successfully succeeded in doing in the past 25 years. Thank you very much.